I'm speaking right now, Lori Connors-Tadros. I direct the Center on Enhancing Early Learning Outcomes with my colleagues and partners, Jenna Martella, Diane Schulder, Jim Squires, Tom Schultz, and Steve Barnett, and all of our staff. We're joined by George Ricketts of Third Sector Intelligence. CEELO contracted with Third Sector Intelligence after looking around at a lot of different partners and consulting firms to help us develop this tool. And most importantly, Amanda Zimmerman, who really is one of the leads in Indiana, works for Early Learning Indiana, and has embraced the tool, learned how to use the tool, and is supporting the work in Indiana to expand access to preschool services, high-quality preschool services in Indiana. So with that, I'm going to start the webinar. And may I ask Melissa or Michelle, did we get to be able to figure out the recording yet?
Yes, we are now recording.
Thank you so much. And we do appreciate folks being willing to let us record it so that it can be available to others that aren't able to attend. So I wanted to put this in context. We do consider this cost work to be part of data-driven decision-making, ensuring that policy can be effectively implemented at the local level with the right supports, both for implementing quality, but the fiscal supports. I know for any of us, including myself, that have been in the field for a number of years, we were trained in the pedagogy of early childhood, and often we run up against the practical realities of financing, and mostly limited financing. And I think in recent years, our field has really embraced the need to understand the true cost of quality and to really advocate for sufficient resources to support a high-quality program, especially as the research has defined that even further. So as we go through the webinar, we are going to speak about costs and how you get cost data, but most importantly, I think our message is how you use cost data, how you use cost data to drive and to understand what needs to be financed in terms of expanding access to more slots for more children, improving the quality of existing programs, improving education or compensation of the workforce, and accountability to monitor and support. So it's really clear to think about, important to think about this in a context of what needs to be financed, and then understanding how much it costs is really critical. I do hear a little bit of background noise, so it might be useful for folks to check to make sure that you're on mute, particularly our staff. In our field, particularly in early care and education, where we have no dedicated and sustainable funding source for the most part, I am sure you all have been in the place where you basically get a certain amount of money, and then you try to figure out how many children could I serve at what quality. And we really want to drive this in a different way. We want to drive our field in a different way to say, here's what we know from the research is good quality. We want every child to have access to this. How can we utilize our resources to ensure that all children have access to quality? And then we want to look at the types of resources we have, the funds, and how that matches up to what it truly costs for quality. So as we move forward, we'd like you to think about kind of a strategic data-driven approach to financing and how this one tool and data it produces may help you in that context. The cost of preschool quality, was designed and built to complement other tools. Many of you are probably familiar with the provider cost of quality that Ann Mitchell developed a number of years ago and is used most often in child care and or with quality rating systems. There are other cost tools out there as well. And we looked at the tools and we said for policymakers that are looking to improve access to high quality preschool, we wanted a model that was based on a default set of standards that could model both the state infrastructure costs and the provider costs together and could provide multi-year projections including the flexibility to mix up, maybe not serving all children in a full day, but in some part day, some full day, some extended day, to be able to model different delivery models, and so that you could estimate the impact over time. So these tools really do complement each other. The cost of preschool quality is able to provide you with data that would help you know how much it would cost to serve children with the current quality standards that you have in place, or if you did not meet all of the near quality benchmarks, how much it would cost to move up to meet all of the benchmarks. What is an adequate per child or program allocation based on total available funding? How does that match the way you currently allocate and or distribute funds? In what ways could you ensure that there's both equitable funds going to communities and the funds are used efficiently, in light of other funding sources like child care or Head Start? Many states now are becoming quite concerned about compensation parity and at least trying to determine and develop solutions to the compensation parity issue. So what would it actually cost you? What would be needed to ensure all practitioners have an equitable compensation pay structure? And then because funding is cyclical, we are relying in many states not only on state funds but on federal funds that might be time limited or other funds. How would you plan for when one funding source is running out, such as the Preschool Development Grant, as most of you on the phone are preschool development grantees? This is the kind of data it can provide. There's quite a bit of flexibility, and you are going to see this in a moment. It is Excel-based, and there's no macros. It's very transparent. We do have a user guide, and you'll be able to learn how to use it. It does require some Excel skills to use it. It does include the default is the 10 near quality benchmarks. And while we know that there are other benchmarks or other requirements for quality, you certainly can adjust those assumptions, but we wanted to almost drive this first with quality. It's very flexible, and as I mentioned, it provides multi-year projections. We invested in this, again, as I mentioned, to help state policymakers. So the purpose of today's webinar is to tell you about the tool, help you understand how it can be used, what the capacities are, what types of data you get, so you can make a decision about whether this would be a useful tool for your state. To give you a very high-level kind of overview of the components, and in a way, as I mentioned, we see this tool as supporting data-driven policymaking. The tool, again, begins with the 10 near quality benchmarks, and then we've identified, we call them ingredients or components. These are the cost categories almost of state-level infrastructure and supports, and then there's a set of provider-level direct and indirect services. It ends up being 23 components. This serves as a data checklist, and as Mandy will share later, there is quite a bit of decision-making that needs to go on at the state level about whether you use the system defaults or what data you have in order to customize it. But in essence, this is kind of a checklist of what are the ingredients of quality preschool program delivered at the state level. As I mentioned, this is the flow chart of the tool. It's Excel-based. I know you all are very familiar with Excel, and there's multiple worksheets, if you will. And noting here, there is a summary page that's the beginning and the end, if you will, and this is where you make some decisions at the beginning about some of the assumptions that you want to use. Again, it is built with a lot of default data. You pull in that default data, and then that drives most of your data entry, and the heart of it, the engine of the tool, is in tab B or workshop B, which is the implementation plan. And that's drawing from the others, the demographic tables, which has state data, annual schedule tables, which allows you to do the multi-year forecast, and some cost models built around state and provider level costs, which gets drawn into the implementation plan. This probably sounds a little bit like Greek, but it will actually, when we do the demo, we will show you how this works out, but just to give you a way of visualizing the flow of the tool. And again, we have tried to design it to the degree possible where it is very, very flexible. It has a lot of built-in data, so you can very immediately begin to see some cost projections, and then from there you're able to make many adjustments. It's a tool you can use, and it's a tool you can use in a variety of different ways. We have defined it for preschool, and that's for 3- and 4-year-olds. It can be, we feel, with very little adaptations, be designed for infant toddlers, but we haven't worked on that quite yet. And it is, again, very flexible, so you can vary it by facility type, by year. You can look particularly and vary. There's quite a bit of comprehensive data around teacher qualifications and what you would need to get the full workforce up to whatever level specificity of educational qualifications, over time. We really felt strongly, based on our own research and our understanding of the state level infrastructure that is needed to ensure quality is implemented and implemented well and consistently in all settings and over time. And there's also ways which you can model it for regional variations, either by urban or rural, or by different levels of access and capacity. Lots and lots of flexibility in the ability to use this tool. So now we're getting to the good part, and really I wanted to tell you a little bit about the way we worked with Indiana. We based the development of the tool on work that George's firm had done in Washington, and as you know, NEAR has done a number of cost studies, particularly in New Jersey and Alabama. So we have some cost data, especially around preschool costs. But we really wanted to pilot the tool, and we were really fortunate to have a relationship with folks in Indiana that represented both the Department of Education, the child care sector, and Early Learning Indiana, which is an independent large provider. And I'm telling you a little bit about the context of Indiana because they do not have state-funded preschool. They have a very small program that goes actually through their child care administration out to quality rated sites. But the stakeholders, the early childhood stakeholders, really were working together, had really come together around the need for preschool quality. They were very fortunate to receive $20 million from the Lilly Endowment and to be able to do some investments in some strategic innovations to improve quality. The way that CEELO works with states, and Indiana in particular, is we identified a leadership team of state leadership and decision makers. We identified a staff team of which Mandy took the lead, and George and myself, but mostly George, worked to build their capacity because our goal is that Indiana uses the tool independently over time to answer their own questions about costs. We've worked very closely with producing some data for the Early Learning Advisory Council, which again is supporting high quality preschool, and it has resulted most recently in the superintendent of the Indiana Department of Education proposing universal pre-K to be implemented by 2020, and they have utilized the cost tool. So we're really so happy to see that as a result of using the cost tool, Indiana has been able to use this data for decision and policy making. I wanted to show you a little bit about, just because people learn differently, these are really some of the initial first draft estimated costs that we presented, and actually Mandy presented to the Early Learning Advisory Council in Indiana. And the reason why I wanted to show you this is that it shows that in our field, you certainly can see the difference in cost by part day, full day, which makes sense. In family child care, the costs are somewhat lower, but not as, there's not as big of a differential in cost among settings as some of us sometimes think. And you really can see, again, the cost differential between part day and full day. Now, that does require a certain messaging around why is it necessary to invest in full day? What's going to be the return on that investment? We know from our research that full day gets you better quality, better outcomes. Secondly, you can see in the far right graph how costs, especially state level costs, get broken down. And these are slot costs, and they do include both the sum of the provider level and the state level cost categories. And you'll see the baseline administrative costs, they really include staff salaries, goods and services, travel, indirect rate that are necessary to operate a state-funded program. And then you'll see other costs here that are very critical that we know from quality standards and from the research are necessary around technical assistance, monitoring, coaching. So again, part of the tool is educating folks on what is necessary in order to achieve quality, and also what are some of the decisions that need to be made at a state level about what to invest in. So with that overview, I want to just check, are there any questions at this point in there? Okay, I'm going to actually turn this over to George, and he is going to give you a demo of the tool. So just give me a second while I transfer the controls. All right, George, I'm making you the presenter. And in a moment, you will see George's screen. There we go. And if you're viewing, make sure you're in the full screen option. You'll be able to see it.
Hello, everyone. It's a pleasure to have the opportunity to speak with you today. This is a picture, a snapshot of the CPQ tool. As Lori presented in the earlier slide on the flow chart of the CPQ tool, you'll see along the bottom there are different tabs that represent the different worksheets that were described on that slide. And there really aren't that many worksheets, but I wanted to first orient ourselves to worksheet B, which is the implementation plan. And I will zoom in a moment, but I wanted to give you at first a feel for the overall layout, look and feel of this page. So this is the only worksheet that requires user input in the CPQ. A little quick guide on formatting. The yellow cells indicate user input, where user input is allowed or required. The green cells indicate model output, and the white cells indicate formulas and other calculations that the CPQ performs. At the top of the page, you can name a scenario and a system that you want to create. You can also select a state from the drop-down menu. So for example, we have Alabama currently, and we can change that to any other state very quickly. So let's say Arizona, and what will happen is the data for Arizona will be pulled from the demographic tables in worksheet C and help to inform certain unit cost and volume assumptions that the CPQ makes. So I'll change this back to Alabama just for the sake of this illustration and because it's the very first state listed. So the first thing I want to show you, as Lori mentioned before, is just moving around the webinar dialog box, which is kind of getting in my way. Sorry, there we go. Is as soon as you enter in a slot count, the CPQ will begin returning cost information to you. So you can always revisit the slot count later, but to really understand the power of the CPQ as well as to begin reviewing the CPQ default input assumptions, it's best to enter in an arbitrary slot count, which I've done here by entering 1,000 full-day slots for child care centers in year 0. Year 0 pertains usually to the current year. In most cases, that will be the appropriate usage of year 0. So you can see as soon as we put in 1,000 slots, we begin to see, and I will zoom in for folks who would like a little larger, that the CPQ is returning cost per slot information because it is preloaded with default input assumptions for the various unit cost assumptions as well as volume assumptions that the user can then go and review and amend as needed. So this is showing $8,670 estimated cost per slot, and approximately 8.6 million, 8.7 million total cost to service those 1,000 slots, full-day child care centers. Now the CPQ is designed to accommodate up to 3 different delivery models and 3 different dosages within a single scenario. So you can see here we have child care centers, public pre-K, and Head Start comes preloaded in the defaults, as well as 3 dosage levels, a part day, full day, and extended day dosage level. One of the powers of the CPQ is that it allows you to simulate changes in the mix of dosages or delivery models over time, as Lori mentioned. And I should also mention that you could repurpose any of these delivery models and any of these dosage models to something new, so long as you make appropriate changes to the other assumptions that come subsequent to this section within Worksheet B. So let's, for example, illustrate a situation where we had 5,000 part day slots. Again, this is Alabama, with just the default input assumptions listed. And that's currently 5,000 existing preschool program, but we wanted to actually model a conversion of those slots over time to full day over a period of 4 years. So I am just simply entering in a schedule. We've not changed the total number of slots, as you can see. If I scroll to the right, you'll see it's still 5,000 slots per year, but we are modeling a conversion of slots to full day. And the CPQ is now presenting to you a total cost and a cost per slot by implementation year, which can really help in for budgeting purposes. As a quick aside, if you were to go to the provider level cost calculations in Worksheet F, you can still see, or will be able to see, the cost per slots by year, but broken out by dosage between part day and full day. So you can see that the cost per slot for part day is around 4,000. It's increasing because of inflation assumptions, which are also in the CPQ. And the full day is approximately around 8,500, and increasing over time with inflation to approximately $9,000 per slot. So there are essentially 23 mini models or components, as Lori mentioned, in the CPQ. So one of the design enhancements we've included in the CPQ is just the simple ability to collapse and open or uncollapse the different component models. You can see along the left-hand side I've now collapsed all of the components. But you could open up any of these components to take a deeper look. So for example, here's the section on maximum class size. We've also included a section for available funding. So it gives the user the opportunity to include information about current funding for existing preschool programs and to be able to forecast that funding. And like any other components within this CPQ model, this section can be modified and customized to fit a state's specific needs. But we've gone to great lengths to anticipate the different ways in which a state may want to or has characterized their available funding streams historically. So I want to take I want to direct your attention back to the top section, table B1, which is the model input, the green section. So there are a more detailed set of model output statistics in Worksheet A, the summary outputs. But this table is included in Worksheet B to help lessen the need for the user to toggle back and forth between worksheets as they make changes to the CPQ. So, for example, as you make changes to your annual slot plan, so for example, we'll now start adding a different delivery model over time. Let's say there's 0 slots in your, but we're going to start adding 1,000 public school slots every year as part of the preschool slot plan. At the top of the page in the outputs, you can actually see, based on your FPL eligibility threshold that you've set within the CPQ, what percentage of the eligible population in the state you are addressing. So in this example, you're increasing from serving 8% of FPL eligible children to 15% through this annual slot plan. Another useful application of this top section is to provide instant feedback on the changes that you're making, such as by looking at the fully loaded cost per slot and observing step changes in that cost over time, and then using that as to help identify cases where you may want to review some of the default input assumptions in greater detail. So for example, there is a rapid increase in cost per slot from year 0 to year 1. Most of that is likely due to the increase in the number of full-day slots, which are more expensive. But some of the other input assumptions within the CPQ could also be affecting that, and I'll go through one example right now. Further down under state supports, there's a section called capacity building. And so capacity building is basically startup funds that would be awarded to providers for increasing their capacity to serve children, so new sites and new classrooms. Now, the model treats year 0 as the beginning of a preschool program, and so it doesn't model any capacity building funds, as you can see through the summary table in this section. So here's a great example of the flexibility of the CPQ, is that if you have an existing preschool program and you have been awarding capacity building funds historically, well, a simple way to address the issue of being able to accurately model current costs is to perhaps model the last 2 or 3 years of costs within the CPQ, making year 2, for example, being the current year. And then that way you will be able to accurately calculate the number of new facilities that were required in the last 2 years, and therefore accurately come to a cost for capacity building funds within the most recent year. And I use this as an example because, as you can see, just within the assumptions we've made within the defaults in the CPQ, these costs are running approximately $600,000 a year. So that's adding about $100, I believe, per child per year. So it is having a tangible effect on cost. So let's talk a little bit, or let's also now talk. I want to show the linear flow of the model. So from the other slide that Lori had presented, showing kind of the flow chart of the CPQ tool, it really is laid out linearly, and is done this way to facilitate understanding by the user and to really try to promote the user's ability to customize, to own, and to use the tool independently. So as you can see, or as we've discussed, the user's interaction with the CPQ begins and ends with Worksheet B, Lori said. Worksheet C is where demographic tables, and I'm showing quick snapshots of these, this is the repository for geographic level data that can help to inform unit assumptions in the CPQ. And a number of tables have been included in the default version of the CPQ. But the number of tables can be added to by the user and will most likely be augmented over time. The annual schedule tables in Worksheet D serve an important purpose, a very important function, because what they do is they're translating the input assumptions in Worksheet B into an annual count of volumes, so teachers, children, facilities, etc. So instead of burying those calculations in the final 2 worksheets, we're actually explicitly creating a single worksheet that's nothing but volumes tables. So this is actually a useful reference as you begin to use the tool to see the count across delivery models and dosages to help you better understand how your volumes are changing over time in order to meet your preschool slot plan. The cost times volumes calculations by implementation year, these are carried out by the final 2 worksheets, E and F. So E is the state level costs. I'll make this a little bit bigger. And this is basically taking the volumes in the annual schedules tables and multiplying that by the unit costs that are being assumed in Worksheet B, the implementation plan. The same thing's happening with worksheet F, the provider level services model. The only difference is this worksheet F is a bit more lengthy than worksheet E because we're actually carrying out the calculations by delivery model and by dosage. So it's actually, there's a larger number of calculations being carried out. And as I mentioned or showed earlier, at the top of this page, there's another output section that allows you to see by delivery model and by dosage how the costs are breaking out in a more detailed form than what is shown in worksheet B. Finally, worksheet A is a summary worksheet that provides a little bit more detailed output information than worksheet B. It also provides, and I'll make this a little bit bigger, a section of showing the index of the cost tools that's hyperlinked to the implementation plan. So clicking on any of these will take you to the appropriate section of worksheet B to help facilitate navigation. Includes a section for you to add user notes of what you're changing or what drove some of these changes you made to the default input assumptions. And it also includes a quick section, an assumptions complete, basically some simple logic that checks whether or not inconsistent or illogical numbers have been entered into some of the assumptions. So the CPQ is designed with several considerations in mind that were intended to promote flexibility of the tool and customization by the user. So none of these components are right protected, as Lori said, and any of these sections can be modified in virtually any way. And we've purposely formatted some of these components, as many as we could, to facilitate expansion by the user. So one example that I would like to go through with you right now is in the personnel model, the provider level. The ability for adding additional rows is needed to more accurately reflect the specific modeling situations that you encounter. So the CPQ default, as we said before, is preloaded with 3 default delivery models: Child Care Centers, Public Pre-K, and Head Start. And as with many of the model components, well, I should say that it is loaded with default staffing models. So as you can see here, we have from Bureau of Labor Statistics, or I should say standard occupation codes. There are various position levels that are being indicated, funding, salary levels, staffing levels. It's very simple to these. I should say these staffing models are varied by the delivery models. So I'm having a little trouble with this, with the menu button for the meeting. Okay, so for example, child care centers it's preloaded with director, assistant director, administrative assistants. You also have floaters, lead teachers, assistant teachers. If I were to scroll down to public pre-K, you would see that for that section, there we go, we have a slightly different staffing model with principal, assistant principal, administrative assistants, and then a place for other staff. So the example I wanted to illustrate for you is how simple it is to add additional rows for additional staff types, because in order to meet your needs, you need a more detailed or different breakout of the staffing model for that delivery model. So for example, it's as simple as we've designed it. If you wanted to add a special ed teacher, for example, you can simply insert a row, specify the position. We'll copy the row down, specify the position, overwrite the salary, and in this case, and now set the new staffing levels. And in this case, the chief one that we're going to add is just to set a threshold of how many special ed teachers at, let's say, 1 for every 24 classrooms for an elementary school. So what's happened right now is we've added this row, and it was that simple. So we now have the model. No other worksheets need to be changed. No other changes need to be made in order to maintain the integrity of the CPQ. It is now including this new staff position into the model, and it was a simple matter of inserting and cutting and pasting, because we've made sure that none of the other worksheets are referencing these individual cells. They're only referencing the subtotal cell. And those types of design decisions were made frequently within the CPQ to help make it easier for states to customize the tool to meet their own needs instead of being forced to work within a pre-designed structure that doesn't allow for such enhancements. So the second major way in which the flexibility of the CPQ can be illustrated is in adding scenarios. So we recognized very early on that it would be very hard to model a black box system model approach, let's say a black box model, or create a black box model that would be able to accommodate the many different types of preschool situations that could be encountered across the country. So one of the ways that we've addressed this, or tried to address it, is making it easier for the user to insert rows for assumptions without having to make a lot of modifications to the other worksheets. The other is in the process of adding scenarios. The scenarios can fulfill two purposes. First, they can allow for side-by-side comparison of alternatives, which is something which is often difficult to do with other models that are available. But it also can be used to model more complex systems. And what I'd like to show you right now is just how quickly you can create a new scenario. So basically, it's as simple as copy and paste. So if you, starting with the implementation plan, if I wanted to create a second scenario, I simply copy and paste, copy these columns, paste them to the right, go to the annual schedule tables, do the same thing. The same thing with the state level infrastructure and support, and the provider level models. I will stop there just for the sake of time. But basically, we now have two scenarios in the model, two versions side by side of the same model. And if I collapse the columns, you'll be able to see a little bit more easily not only that we have two scenarios, but also how easy it is for you to add an unlimited number of scenarios to the right and make some very quick comparisons. So currently, these two scenarios are showing the same costs because they are no other changes have been made to the model assumptions. There we go. I'm trying to zoom in a little bit again. So let's, for example, show what happens or how we could use this to compare an alternative. So if we wanted to, for example, model as the default that the current maximum class sizes, there was no current standard on maximum class size, and it was known that currently the maximum class or the class sizes tend to run higher than 20 students. So let's say we put it at 25 as in the average number of preschool students. We make that change and consider that the kind of the current state, the default. And now, as you can see, we have the ability to compare the cost, instantly see the cost impact of reducing that from 25 children to 20 children as the maximum class size, which would give you an expected class size from currently of 22 to 17, based on some assumption around an efficiency around enrollment, which is just a way to be kind to the providers. But you can see that very quickly we've been able to establish approximately a $400 per child cost impact that would arise from reducing that class size. So in this way, creating multiple scenarios can allow you to quickly compare policy alternatives. It could also, and I will end with this, allow you to create more complex systems. So for example, if we wanted to model a system that was comprised of the first scenario being purely 3-year-olds and the second scenario being purely 4-year-olds, wherein they might each have dedicated classrooms and they had different maximum class sizes and different adult-to-child ratios, then you could create each of the scenarios and basically treat the two scenarios, the sum of the two scenarios, as the whole system. And that is why we have the system names included at the top to allow you to kind of keep track when you're creating a multi-scenario system versus comparing one or more scenarios for policy considerations. So hopefully this is giving you a kind of a good overview, and I'd like to pass it back to Lori if there aren't any questions.
Well, thank you, George. And I'm hoping the demonstration showed you both the utility and the flexibility of the tool. We tried to balance, again, what would a policymaker need to know? What but what would be kind of the comprehensive set of data that you'd want to have, and particularly driven from quality? And as you can see, it's really not just a static tool. It's really does involve, you know, those in authority and those that have data on, you know, what are the current slots and how do you decide how you're going to ramp up or increase access? What is your delivery model and dosage? And how would you want to address changes in quality? Again, we really wanted to provide some flexibility, and that's why there is nothing protected in it. You know, most is not of the cells are not protected, and you can have some flexibility. However, there's a lot of default data. I think the proof's in the pudding, and so what I want to do now, give me a minute, or proof's in the using, is I really want to introduce you to Amanda, again, who has taken the lead on behalf of Indiana, really the Indiana Early Childhood Stakeholder Team. I just transferred the controls back to you, Amanda. But I want to tell you a little bit about, again, Amanda has become over the last number of months, you know, quite facile in using the Excel tool. And she had the support of her direct supervisor who allowed her to have the time to use the tool. She had the support of a team who provided her with data or helped make decisions when they didn't have good data. And she's going to share that with you. She's going to actually show you a specific example in Indiana that probably many of you face around really looking at the data around the workforce and how would we know both, how could we plan for and understand, again, the true costs of increasing qualifications of the workforce. So I'm going to turn it over to Amanda or Mandy and thank her so much for joining and sharing how she's learned to use the tool in Indiana.
All right. Thanks, Lori. Can you see my screen now?
Yes, I can, and hopefully everybody else can, but just let us know or send us a chat if you can't.
All right, great, thanks. Well, good afternoon, everyone, and thanks for joining us on this webinar. So I want to begin by giving you just a little bit more information about Indiana. I know Lori touched on some of the context earlier in the webinar, but Indiana is currently piloting a few different public-funded preschool and pre-K options with some variation on requirements and standards for each. So we have On My Way Pre-K is available now in 5 counties. We have an early education matching grant that's available to select providers around the state. And the city of Indianapolis also has another local pilot. So with each of these programs, we've gained some good insights into what really works for our state and our local communities. And we're also pairing these pilots with a strong, well-established quality rating and improvement system in what we call Paths to Quality. So Paths to Quality, you'll see, corresponds well with some, but not all, of the NEAR standards that are referenced within the CPQ tool. The other thing that Lori mentioned earlier is that Indiana does believe strongly in a mixed delivery system in which parents get to choose from a variety of provider types. So center-based care, registered ministries, family child care, Head Start, public schools. We think those options are good for parents and ultimately the children that are served within preschool and pre-K programs. So given that context, we had a couple of goals for piloting this model. One was to help George and Lori and the CEELO team identify areas in which the tool fit our needs nicely and some ways it could be modified to better fit our situation. And also for our state, it helped us think more about not only our quality standards, but also which quality factors are also cost drivers. So piloting this tool gave us good information about what data we already had that felt really solid and reliable, and what areas we need to think further on or model differently in the future to get better estimates. So with that being said, this past spring we completed some initial projections based on data from one of our pilot programs and the corresponding ratings on paths to quality that providers needed to meet to participate in the pilot. We knew this was an important but first iteration for us. So we now have plans to expand on and work more with the model to really refine our estimates. So the numbers and results you see here we consider solid and well-researched, but they're really the first step in an iterative process for us. It's work that we are building on and refining right now. So what I'm going to do now is walk you through some pieces of our model to give you a sense of how we used it and some key decisions we made. We started by thinking through our slot plan. And the slot plan is, of course, how many children you're anticipating would attend the program. In our case, we wanted to project over the next 5 years. Because our current programs are pilots, we had a relatively small number of participating children to base our projections off of. We knew that we had stakeholders who were interested in modeling the costs associated with scaling up the number of funded slots available. And we also knew that we would be maintaining our mixed delivery system. So the first thing we did was to make sure that we had scenarios that fit each of our delivery types. So you'll see that the section I have open right now includes child care centers, public pre-K, and Head Start. We also then added another scenario for family child care. The other decision we made early in the process was to look at costs separately, not only by provider type, but also by geography. So whether or not the provider was operating in an urban or a rural area. So for our work around estimating the true cost of our pilot programs, we had 4 scenarios. We had the urban centers, schools, and Head Starts, which you can see down here. We had urban family child care, and then we also had rural centers, schools, and Head Starts, and rural family child care. And those are each separate scenarios. One thing I love about the tool is you can open and close them. So depending on how overwhelmed you're feeling that day, you can leave some of them or all of them closed if you'd like. At that point, to give us a starting point for scaling up, we also looked to Lori and others for advice on what might be realistic. And we decided that we wanted to see what it would look like if Indiana was serving about half of its 3- and 4-year-old children living at 125% of the federal poverty level or below. So that's where these numbers that you're seeing for the projected 5 years are coming from. It's population and poverty data used to hit that target. We also use data from our pilot to figure out the current proportion of those in part-day versus full-day programs at various provider types. And we tried to maintain that proportion over the scale-up. So those are the main considerations that went into developing our slot counts. And that part seems like it should be the easiest, but in reality it really took some thought and coordination amongst the members of our team. After deciding on the slot count and the various scenarios by geography and provider type, it was really about working our way through the sections of the model. So thinking about the near standards and how our standards for high quality aligned, or in some cases didn't quite align. And you'll see as you go through the model that depending on conditions in your state, some areas are more difficult than others to complete. For us in Indiana, the teacher degree section was a real challenge. So let me open that one up and I'll talk a little bit more about it. So this section is designed to let the user identify the proportion of teachers at various degree levels and then indicate what proportion of teachers are actively working to increase their education and so therefore will need some sort of tuition support. What made this section difficult for Indiana was that our teacher registry here is still a work in progress. We don't yet have an official state registry that we can access to get data on teacher education levels. So we had to rely on some other sources here, including Head Start data and a recent teacher survey, and really decide as a group what seemed reasonable. So we use this section really as a way to qualify where we think teachers are now, rather than project any drastic changes. So you can see in the yellow cells here, we put in our reasonable estimate of what percentage of teachers had bachelor's degrees and associate's degrees. And we also made an estimate of how many teachers would be participating in tuition support or assistance via state funding. And that you can see here in these yellow cells down below. So again, the yellow cells are where we typed in our numbers, and then the white cells are calculations that came out of that. All of this data then feeds into another related section in the provider level area of personnel costs. So this section, as the name implies, is looking at compensation for teachers, directors, and office staff. We used salary information from the Bureau of Labor Statistics as our starting point, and then we were able to vary those salaries based on education levels. So you can see here that we have our teachers with bachelor's degrees making the highest salaries, followed by those with associate's degrees, lead teachers with no degrees, and then assistant teachers with and without CDAs. Along with teacher education levels, we also thought about state geography when determining teacher salaries. So the view you're seeing right now is our urban child care centers, schools, and Head Starts. When we created these salary factors, we accounted for not only salaries varying by education level, but also by whether the program was in an urban or a rural area, because we know that salaries tend to be higher in our urban areas. So what you're seeing on the screen now is actually the salary factor for our urban center-based teachers. And the factors look a little different for our rural centers and our other provider types. One thing I'll mention quickly here, because I think it is a real benefit to this tool, is that if you're in a situation like Indiana where you aren't exactly certain of your teacher education levels, or you don't know that you have the best salary data, you can use these sections to input some ranges. So you can put in some very low and very high numbers for teacher education to see how much that really affects the overall cost and the cost per slot. And that's something that Indiana is looking at doing more of as we move forward with some more modeling. So especially thinking towards the future, you can use these sections to answer questions you might get from leaders in your state. Questions like, what if all of our teachers were paid on the public school salary scale, or a teacher had a bachelor's degree? The tool is good for assessing your current state, but also thinking about possibilities for the future. The last page I want to point out to you is this page labeled Blank Worksheet. Let me get this loaded and zoomed in for you. Okay, so with George's help, we used this extra included page as a way to summarize the results of our initial run-through. So when I click on this page, I see the summary data for costs and cost per slot, and I can quickly scan through to see things like how costs per slot change when you're looking at part day versus full day, or child care centers in urban versus rural areas. So this is really great for double checking your work and kind of gut checking that the totals you're getting are on track and they're not due to a typo or an off piece of data. You can also feed this information into some simple and easy to understand charts, of which Lori showed a couple of earlier. And you can use these for presentations, really to illustrate your results and help your various stakeholders understand the cost variation. once you have these charts, you can also use them to work backwards a little and anticipate that people will ask questions, like what is really driving these differences between provider types. And you can then go back into some of your more detailed pages and start kind of drilling down from there to find the answers to those questions. And a lot of the questions that people have after an initial run-through or an initial building of scenarios, then those questions really drive some possibilities for future scenarios, which goes back to what I said earlier about the Indiana team really seeing this as an iterative or a cyclical process. So that's really a quick intro into some considerations that went into Indiana's use of the tool. I hope that helps you to see and hear about some work being done by a state who really had no previous background with the tool. And we just went into this with an open mind and a desire to estimate the costs associated with scaling up our mixed delivery system. So that being said, I'll go ahead and turn it back over to Lori.
Amanda, thank you so much. Again, I'm just always, hold on, let's see, okay. Always both just humbled and grateful to Amanda and Indiana for really being willing to work with us. You know, as a TA center, we actually rely on you quite a bit. So there's a couple points I want to make before we do open it up to questions. One is that you noted what Mandy said, that you are making some decisions based on good enough data, reasonable estimates, and you know, that's the power of kind of data-driven policy making. It is not going, or decision making. It's not going to be perfect, and that's one thing to just get comfortable with, especially with a cost tool. The other is that it's scary. What happens when you get cost data that you don't like, or that you know a legislator isn't going to like? Or, and so you really want to, you know, go into this with a conviction that true cost of quality data is critical to actually getting the outcomes for children. And we mostly have been doing a lot of blind policy making and actually funding. And that may be one piece, and again, only one small piece, potentially, of not realizing the outcomes that we would like. But in essence, again, we are working on really closely, both you know, with Indiana and their full team, and there's quite a lot of other folks there that are very savvy about how do you communicate the data. And I'll just tell one tiny story while you all get ready to submit any questions about when we first presented this to ELAC, which is, you know, chaired by a business person. So when we showed him the first slide, which we didn't show you, but, you know, where it was really getting at that, you know, cost per child, I would say that his reaction was a little taken aback that, you know, that quality costs so much. But, you know, we also tried to, and Mandy did this again, did a beautiful job, and others there, try to, you know, help him and others on the team understand what were you getting for that cost. You know, what were the ingredients of quality? While Indiana does not have a state-funded pre-K, they actually have a very effective quality rating system that actually has very good evaluation data on the quality of the program, on their monitoring and technical assistance and coaching and professional development, which we know leads to good outcomes. So I was just, you know, by the end of the call, he was asking for the cost projections and scenarios, as Mandy mentioned, that would show compensation parity across the different settings. But I do think you need to be really careful, but it's better to have good, solid, true, you know, as true as could be, or good, solid information in order to make decisions, and then be prepared for how are you going to use the data, how are you going to make meaning of it. The second piece I'm going to do to tell you about is that, you know, it does require some internal capacity and time, but not a lot. And we are able to support you, and I'll talk more about that in one more second. So, and we will be working, again, what Indiana has done now is they've actually invested in a data team that is, with a variety of other staff. George is going out to train staff from the Department of Ed, Department of Family Services that runs the child care and early learning, and Indiana's data team in the tool. So they are going to be launched, and they will then we can just help them with some coaching and some policy making decisions. So that is our hope for any of you and others that would like to use this. I'm going to ask for my colleagues to help me with any chats and questions, and I actually could unmute people. So we would love to. I'm going to go ahead and do that. I'm going to unmute you now. I just have to do it one by one. But if anybody wants to either speak up with a question or their experience, and others of you have used cost tools or cost data or attempted to get better understanding of the true cost. I'm going through unmuting everybody. That may not, if you have, see that. I guess I'm going to have to mute. Submit questions in the chat box. Al, can you help me? I'm trying to mute all, but it's working now that I unmuted everybody. Okay. Sorry about that. Submit questions in the chat box. I can't, unless Melissa can help me. Sorry. Alrighty. Okay. Looks like there might be a question. I'm going to try to, oh, okay, good. All right. So I don't see any questions in the chat box.
I see one, Lori, although admittedly I'm having a little trouble responding to it.
Okay.
But I did respond. I offered a response. I think Mandy might have as well. Mandy, were you the one that, this is regarding the bar chart in your case study?
That was not me, actually.
Okay, well, let me go. I see the question now. So I see a question from Sue Reed. Thank you for, it has been a lot of great work. We're really passionate about it. We know it takes a little getting used to. So her question is, I am wondering how, if any state has used this, whose pre-K funds are determined by local funding formulas. So, Susan and others, we are really at the beginning of using this tool with states. We've completed the work with Indiana. We've just started to work with Washington State. We have done some cost projections again for Alabama, and we're going to begin to work with New Mexico, potentially Colorado and other states. We're really at the beginning. But to answer your question, we could work with a state and build out the funding resource section and add in local funding. So create a scenario for certain counties or districts that possibly have city funds or county funds or some other types of local funds. That is part of the flexibility. I will say that we're also planning to work to develop additional robust around the funding so that we can really be sure that we are calculating costs for all the different funding sources. And I know Rich is on the phone, but we have one of our staff who's actually doing quite a bit of research by state to determine what other funding sources states are using in addition to state pre-K funds or child development funds or Head Start funds to support preschool services. But yes, the tool is adaptable to including local funds. Is there other questions? I don't see any other questions that we could answer. George, do you?
I saw one. I saw one about someone asked about the bar chart appearing from Mandy's case study, appearing that schools would be the choice of last resort. for placement if quality is equal across all. I think that, and there was an answer to that, which I think is a good answer. I would just add to that answer to say that, there's a relationship between the costs that in Indiana, for example, that they observe for salaries across the different delivery models and the qualifications of the staff in those delivery models. So it public schools had higher salaries. It could be from collective bargaining, but it could also be a function of just more degree teachers. So the expectation perhaps is that, to improve the quality in private centers, higher wages and higher degree expectations could be assessed onto private centers, which would you then see that gap in cost narrow.
Right, and I think the numbers as well. So again, we want to understand what is the true, not only the true cost, but what are the ingredients, as Mandy said, that are the cost drivers, and what are the deltas. So I'm going to leave it at that. Again, you can submit your questions, or you know how to reach us, or your TA lead. I want to be sure that we, feel free to send us any questions. I'm sorry I wasn't able to actually unmute everybody because then I heard some background noises. But again, as I mentioned, the tool is available free of cost. We ask you to complete a licensing agreement, or if that is something that your state doesn't feel comfortable with, we worked out a little email agreement, and that is mostly only to be sure that the tool is, referenced properly and that we keep track of who's using it, because we are continuing to enhance it. I think we're on our maybe 5th, 6th, or 7th version of it just since we almost started with Indiana. So you can access this at any time. Now, we're developing a number of resources and supports to help you learn how to use it, this webinar being one of them, and it will be posted. Michelle, we can put that in the chat box now. The recording will be posted, and all of the materials will be posted on our website. We are in the final stages of a user guide, a very detailed user guide that takes you step by step through the use of the tool. Includes a glossary that defines every element and data element, and includes 2 case studies. We're doing final edits on that, and that should be out by the end of July. We are hoping to develop very short, 10, 15 little mini modules that someone could go on and say, I'd like to learn the basics, I'd like to learn how to do multiple scenarios, whatever it happens to be. You are able to contact us about technical assistance to use the tool, to help, as you saw, some of the decision making that needs to go on in terms of identifying the data and making some decisions about your slot plan. Or in Indiana, we actually did an analysis about the near quality standards and the quality standards across the different types of preschool programs that you might have in your state. So we're happy to support you in the use of the tool. Whoops, something happened. I'm sorry. Hold on. You should check out our resources. Again, as I mentioned, we really want to help folks think about financing strategically, of which knowing what you want to finance, being very clear about that and what your question is, understanding the costs, looking at funding sources, and financing strategies. So we have some tools that have been developed, and we'll be developing additional tools over the course of the next number of months and year, I am sure. These are a few that we have on there. We thank you very, very much for being on the call today, for listening and being engaged with us. We will be sending you evaluation. We really, really want your feedback, both about how we deliver a webinar, how you might use this, how we could be of assistance to you. I want to check one more time if there's any questions that we need to answer. Anita, Allison, I can unmute you if you would like to share that. That would be good, good information. So I'm going to unmute Allison, who is from Alabama, And I'm going to make you a presenter, Allison, so you should be able, no wait, how should I do this, folks, so that I can unmute you?
Can you hear me?
Oh, great, thank you. Thank you, Allison. That would be great if you would tell us a little bit more about your experience with cost tools and cost data.
Absolutely. Well, I'm the executive director of the Alabama School Readiness Alliance. We're an advocacy coalition pushing for pre-K expansion in Alabama, and I just can't say enough about the great work of NEAR and of CEELO, and we look forward to our updated cost study. We had a cost study done because business leaders in our state were asking what the cost of high-quality pre-K would be to cost it out for all 4-year-olds, and it's something that we as advocates hadn't ever thought of, because I think, as you referred to earlier in the webinar, as advocates or as even, as program administrators, we kind of tend to use whatever funds the legislature or whatever body is appropriating them, whatever they're willing to give us. Well, when our business community asked for a cost study, it completely changed the game, and we were no longer asking for whatever we could get from the legislature each year. We developed a 10-year plan to phase in full funding for high-quality pre-K. We already had a very high-quality program, and at the time that the initial cost study was done in 2012, Alabama's first-class pre-K program was only reaching 6% of 4-year-olds, and the level of funding from the state was $19 million. Over the last 4 years, since we released a plan to fully fund the program within the decade, legislators have grown funding for the program to a new level of $64.5 million, and the program is going to reach 1 in every 4 4-year-olds, or 25% of all of our 4-year-olds this year. And we believe that we will be able to reach full funding by the year 2022, so that all 4-year-olds who wish to have access, whose families want to enroll them, will have the opportunity. And we may cost out, speeding up that cycle, since there's so much support for the plan. And we just can't say enough about, go ahead and cost it out, say what it is you want, have a goal and a phase-in plan. And the legislators have appreciated that so much in our state. So I hope you all appreciate that positive note as we end this webinar. I mean, I have been so thrilled with the tool, and I can't thank you enough for all the work that you've done.
Well, Allison, really, I really appreciate you offering to share that. And we didn't actually, plan that in advance, but in essence, it's been a really positive story. But I do think you also make a really good point, Allison, or model, working with your advocacy organization. And I will say that, this has been our experience in Indiana, because they can push from outside government to support both for the need for preschool. They understand the need for good cost data, and I think you're also able to help policymakers understand what this means and how you might phase it in. And in Alabama, in particular, they have had a very high quality program. So I want to thank you again. I know it's a little bit hard to see the questions in the chat box, but if anybody else wants to me to unmute them, just let me know.
Lori, I see another question that's come up, or clarification. Someone's asking about, asking about the local funds and pointing out that their state education agency preschool funding is based on a formula that differs across the state.
Could you answer that, George, then?
Well, I think if I understand what's being asked, I think my response would be that the functionality of the CPQ to allow you to create multiple scenarios would allow you to accommodate modeling at the state level a preschool funding system that's comprised of, let's say, a certain number of regions, each region is being defined by the formula that's being applied for that funding. So if there's 10 different, basically you could group all the school districts, for example, into 10 different groups based on the formula that's being applied, you could create a scenario for each of those groups and then vary the assumptions accordingly. That's one way you can handle dimensions that vary below the state level.
Right. So I think, again, that's why, again, the tool has a lot of defaults, but it is able to be adaptable, and that's why we know and we're prepared, we hope, to provide technical assistance to states to use the tool. Obviously, we want you to use a cost tool. We believe we've provided you with another tool, a very important tool that we've tried to develop to the best of our ability. We will continue to enhance it and continue to be available to support you. So I do want to thank both Mandy for being on the phone and being willing to work with us over these past many months, with George for his really exacting work and deep understanding of costs and learning more and more about early childhood and early childhood policy and our capacities to use cost data. And he's a fantastic partner. We will continue to be working with 3SI. I want to thank all of you for being on the phone today and spending time with us. And for those states that we will see in August in Boston for the financing high-quality preschool peer exchange, we'll look forward to talking more, both about cost data, but then really looking at the adequacy of your current funding and the efficiency of your funding and how you are maximizing, leveraging, and planning for the sustainability of either PDG funds or increasing access. So please be in touch with us. All of the materials and the webinar recording is on our website, and we are accessible at any time. So thanks for all the staff that were on the call today as well. We hope you have a wonderful rest of the day. It's just Tuesday, and have a great week. Remember to complete your evaluation. We really, really appreciate it. Thank you.